Hello, ladies and gentlemen. I'm Dr. Liu from China. Our Chiari and Syringomyelia Institute, located in Beijing, China, is dedicated to the study and research of Chiari-1 malformation. My topic today is posterior fossa volume of Chiari-1 malformation. Is it really smaller? There are various literatures on posterior fossa volume measurements in Chiari patients. Accurate measurements have been carried out regarding the posterior fossa boundaries, posterior fossa volume, as well as certain ratios. From this slide, we can see the boundaries used posterior fossa volume measurements. Posterior fossa boundaries are in fact inferior to the tentorium, which has been applied to the posterior fossa measurements presented today. This is a posterior fossa volume plaster casted from a human skull specimen. This is a posterior fossa volume obtained from a mimic volume measurement software. This is the cerebrospinal fluid space volume obtained with mimic software. It is clear the posterior fossa volume from the Chiari group is smaller than that from the control group. On the other hand, there is no statistical significance when comparing the volume of total hindbrain in the posterior fossa between the two groups. This is the ratio of tissue volume within the posterior fossa compartment to the posterior fossa volume. The difference is significant. Furthermore, we calculated the ratio of this tissue volume of the cisterna magna compartment to the cisterna magna volume. The difference between the two groups is more prominent. Narrowing of the lower portion of the posterior fossa, it has the cisterna magna, has been observed in both groups. However, it is more prominent in the Chiari group than the control group. This is like these two funnel narrowing. One is more constricted than the other. Comparison of the two groups in clivus length, supraoccipital length, and posterior cranial fossa length shows difference with statistical significance. This is consistent with literature. Conclusions. Chiari is possible caused by a funnel narrowing constriction of the posterior fossa. The lower portion of the posterior fossa constricted as a whole piece, leading to an increased ratio of tissue volume to posterior fossa volume. To improve this ratio via focal enlargement is impractical. It is like when someone has benign prostatic hyperplasia, unzipping the fly wouldn't help improving the dribbling. Prostatectomy may be required. These also offer explanations to normal posterior cranial fossa Chiari malformation and spacious subtype Chiari malformation. Is referring to a recent article by Dr. Oldfield. I want to emphasize that current surgical approach focusing on improving ratio of tissue volume to posterior fossa volume is not practical. He's talking about extradural decompressions. Viewpoint number 2. Chiari is a systemic disorder because it is related to prenatal development. Chiari is usually accompanied by other disorders, such as platybasia, C1-2 fusion, instability, tether cord, occult tether cord, etc. Therefore, Chiari should be redefined as Chiari malformation syndrome, further categorized in Chiari dual, triad, and tetrad. Other conclusions. Mimic volume measurement is accurate and can be widely used. Current popular surgical techniques are focused on improving CSF circulation, such as posterior fossa decompression, revision, MIST, even the C1-2 fixation. MIST is minimally invasive subpial tonsillectomy, which will stop arguing which technique is optimal. Instead, we should choose a minimally invasive technique that can improve the cerebrospinal fluid circulation. Thank you. Sheshe. Okay, so now you're going to give me a second, and I'm going to connect with the Dr. Liu and his translator for questions from the audience. I'm going to have some questions from you. So, Xiaomin, you can call me through the Skype.
其实我需要再说一遍吗？有问题吗？您能听到你的声音吗？要回应是吧？我现在听不到。
Dr. Liu?
Hello.
Hello, my friend. So,
Hello, 大家好。
can you hear me now?
Hi, everybody. Good morning.
我是Dr. 刘。
您再把您的之前的再说一遍，我给您按一下好不好？
我是Dr. 刘，然后我现在在北京，XXIX和体育公众研究院研究所参加网上的这次大会。
Good morning, everybody. I'm Dr. Liu from Beijing, China. I'm attending this conference via Skype in our institute, Chiari, and the Syringomyelia Institute in Beijing, China. And thank you for the opportunity to share with everybody my experiences and research results.
首先感谢大会主席罗宾斯的安排，让我提前来做了一个报告，然后也感谢他刚才现场的翻译，谢谢他。
Thank you for the opportunity, and everybody, thank you for the arrangement to meet my timelines, and I really appreciate the opportunity.
大会上我也看到很多老朋友，也是这次参加会的世界顶级的专家，比如说 Professor Pascal、Professor Brigham、Professor Flint， 还有 Professor Michikawa， 还有 Professor Tutule。Yeah.
He just wanted to say hi to all professors and specialists who attended this meeting, and he is ready to his question. 就是我刚刚这个给您分，然后现在他已经有第一个问题了，然后第一个问题是您能描述一下 MRFT 手术是什么？然后您这个开发这个手术的当初最初的目的是什么？一个是什么，是为什么
？MIST 手术呢是应该叫微创的一个手术，它主要解决的是神经扁桃体，它主要解决的是枕纳石的一个成型的问题。
MIST. The first question, what is MIST? MIST is a minimal invasive surgical approach. Its main purpose is to to resolve the underdevelopment of cystic magnet.
那么诊断池成型之后呢，它最终解决的是这个脑机液循环的一个关键的一个状态，所以它的目标还是解决的是脑机液的循环，而且这种成型呢，它就能够解决的一个是形态比较好，所以并发症比较少。
他刚刚问的第二个问题就是诊断池的重要性，然后我应该可以用这个给你他解释吧。So after we restore the cistern magnet, the ultimate purpose is to restore the cerebrospinal fluid circulation. And with this technique, it's more effective and with less complications. 刘主任，这个 MIT 他问这个手术的切口平均大概多长？
平均大概有2公分半，2.5到3公分左右。
It's usually tall in the range of 2.5 centimeters to 3 centimeters.
要是在小儿或者儿童的话，那么这个切口还可以更小，甚至到1.5公分，15多毫米。
For the education, the incision could be limited within 15 millimeters.
我说
Even smaller. 您说是什么切口？
我说的这是皮肤的切口。
皮肤的切口。对，它是问皮肤切口。他在第二个问题，然后您之前问的那个，那个结束了。我现在等他的下一个问题。
你把刚才我说的几个专家呢，的名字大概记一下。一个是
您给我编个短信吧，我这边我看记不全。
我现在你就记住音就行了啊，到Professor 到。
好。
我要不给你拼过去，你记一下。别人。
然后他的下一个问题是您在您的职业生涯中见到过的皮二畸形病人的数量。
我现在接近的数量已经有2万个。
So the next question is how many PRK has Dr. Liu seen in his career? His answer is that he's seen over 20,000 patients with Chiari malformation in his career. 您继续说刚刚的那个名单。
名单第一个是Professor P.A.T.Z.B.O.R.F。
您先不要听了，这个他们都能听见的。然后那个下一个问题是您觉得皮二畸形在中国更常见吗？发病率更高吗？
不是的。照常这个不是的，发病率和那个是患病率应该讲，我们中国还没有做过这样流行病的调查，但是还属于少见病的一种。我们都参考的还是美国的这个发病率、患病率，并不是很高的发病率，只是因为我们专门搞中国人口也大。
The next question is, does Dr. Liu think that Chiari malformation is more prevalent in China? His answer is no, we do not have official epidemiology report, and those for prevalence and incidence We think it's still a rare disease in China, and currently the statistical data we use is coming from the U.S. and Europe.
因为我从2001年一直搞这项工作到现在已经有17年头，现在我们专门设立了研究所来搞，除了一个专科，还有2个中心，还有一个研究所，一个团队来进行专门对这个疾病的研究。
The next question is how many Chiari surgeries has been done so far? 您现在是手术的话，这个开始进行手术的经历，您做过手术大概多少遍？
我开始新做的时候大概有接近4800多例吧。
4800多例。然后还有一个这个颈枕的这个固定手术，您有大概做多少例？
因为固定手术大概我们做过就大概是240多例。
240. So, next question, how many Chiari surgeries has Dr. Liu done so far, and how many cranial cervical fusion surgeries has Dr. Liu done so far? So Dr. Liu has started his career the study and treatment of Syringomyelia ever since 2000, which was 17 years ago. Now we have an institute and a facility, which is an independent institute, and he's also an associate in one of the best neurosurgery hospitals in China, which is in Beijing. And during his career, he has performed about 4,800 cases of Chiari malformation and 240 cases of cranial cervical fusion. 还有一个问题是那个您这个脊髓穿系的手术有多少例？
脊髓穿系的手术加起来大概这么些年一共做了接近有1500多例了。1500例。成人脊髓穿系合并有
Next question, how many pelvic cord surgeries has Dr. Liu done so far? The answer is the patient usually treats adult pelvic cord syndrome with Syringomyelia, which is around 1,500 cases. 下一个问题是您认为这个中国人或者是说东亚人口的这个颅骨是要就是枕部要比这个黑色人种要小吗？
这个问题我们因为没有这个对照组。我们只比较了我们中国人的一个数据和一个对照组和病人，我们很想开展这项国际间的合作，然后把黑人、白人，还有我们亚洲人如出大小都进行对，这样的话我们能在世界上面能够揭示这样的一个疾病的一个整体的一个基本问题，到底是大了。
然后您现在说的是在中国人口做的比较，这个是怎么比较？是只是说在东亚人口之间吗？
就是在我们中国人在中国人
这是您只做的中国人的这个颅大小，没有做比较是吧？
中国的正常人和我们中国的
The next question is the Chinese or Far Eastern Asian skull smaller than in black population, the octopus? So the answer is since we do not have a diversity of population here in China, so we didn't really have the access to a different race, data to a different race. So right now, what we did is the study between patients and non-patients, control group within Chinese population. And we are looking forward to cooperation with America and Europe, because in that way we can actually have access to Caucasian and African American patient data, and also that would give us a better picture of what really is going on with as far as regarding the size of the octopus and the patient and the normal population. 刘诊他刚刚这个是最后一个问题，然后他说你可以跟观众说一下。
好的，这个在注册到这个原版型，我也接受我认识和我同事的能力的好合作。哎，还在吗？
喂，
喂，我在。喂，本局。
哎，刘诊你说。
然后呢，我也非常感谢，这次大会的这个我所认识的一些好朋友、好专家、世界的顶级专家，有Professor Pascal、Professor Flynn、Professor Ishikawa，还有 Professor Dudley，祝他们这个大会取得圆满的成功。好，谢谢大家。
Finally, I really want to say thank you to everybody who attended this meeting, and thank you for the invitation and the opportunity. And I want to give my greetings to Professor Nishikawa, Professor Boswell, Professor Flint, and Professor Sodok. I'm sorry if I mispronounced your name. And in the end, my best wishes to the conference. Thank you, everybody. Have a good day.
Thank you very much, Dr. Liu.